I'll sort of go to Meena and then ask the free-flowing last question. The last question is, healthcare is, I think one of you said that it is, I think Ashutosh again said, it's not only the hospital last mile, fine, the patient goes there, and for home care also the patient is in that segment, but it's like a jigsaw puzzle with all the segments playing a major role, and we need possibly a very harmonious approach amongst the various segments to be able to succeed, which is giving quality patient care in an affordable manner, to the last mile, that is the patient. So in this context, what has the pandemic taught us in terms of, I know we touched upon the technology, we touched upon operational model. If all of you, I request in the next few minutes to summarize. This has been a beautiful discussion, by the way, very free-flowing, and I would really appreciate if you can give your, couple of thoughts which we can carry forward. What are the key things? What are the key things? Like, we are in response stage now. After response, possibly there will be a reset because life will not be as usual, and then we have to reboot. So, in this context of the 3 R's, would all of you, Rohit, you are on the screen, at least I can see you. Can you sort of give your 2 bit? Then I'll go to Meena and Ashutosh and Dr. Lal, of course.
Sure. So I'm just going to, I'm just cognizant of time. So there are basically just 2 things that I would like to say are definitely very, very crucial. One is the move to digital. I think this whole, thing about remote connectivity, whether it is about treating patients, diagnosing patients, taking education, a lot of our children are actually taking remote classes also, working from home, all those things. This is new reality, not going back again. Has to happen. So digital is the first truth, has to happen, no turning back. And the second one is collaboration. In tomorrow's world, you cannot stand alone on your own and try to do things and achieve things. So I think you have to partner with everybody. We are at the bottom of the pit right now. For us to get out, we have to stand on each other's shoulders and help each other out and pull each other out of this hole. So that we can all then prosper.
Excellent. Digital and collaboration. Meena, your 2 bit, please.
Sure. So a couple of things that come to my mind is that different parts of the whole healthcare ecosystem have worked, like we all said, in silos, and they have to come together. And the reason why they have to come together is not just because the normal is changed or people will now look at digital, but also there is a whole extremely vulnerable population, which is the seniors, people with comorbidities, will not be able to access healthcare the way they were doing earlier. They are not going to be able to, or willing to, or it is not appropriate for them to even walk into a local clinic or into a hospital setting for some time to come. So how do you still serve them? And how do you bring all the pieces that are required for them to be served? Whether it is just a consultation, diagnostics, some support in a hospital thereafter. How do you keep on making sure all these pieces work well, especially for the more vulnerable section? That is one point that I'd like to say. The other is that the government has really taken a couple of steps forward. In some ways, it looks draconian, but on the other angles, they are really needing the support of the private sector. This is not going to be a solution that can be done just by the government or only by the private sector. We've always spoken about PPPs, and PPPs have not been the most shining success in many of the places in healthcare, but I don't think there is much choice. This is the time for us as a country to rebuild, whether it is our healthcare or the economy. Everybody, the government and the private sector, will have to come together, and I do believe that the government is looking at this a little more openly. They are co-opting people so in their solutioning, because they don't have all the answers truly, and something of this nature has shown that the answers are not with the most intelligent people in the bureaucracy or in the government, but all of us have small bits. But when these bits come together, then things really change. And especially they are looking at entrepreneurial kind of solutions, and the the pace at which they are talking to us about solutions is just incredible. You propose something, it makes sense. They said, yes, let's go ahead. Within a week, we're up and running and doing something. I mean, those are things which are unheard of. So clearly, everybody is hurting. We all have to come together, and this is an opportunity to do something very, very different and innovative, especially for the vulnerable sections.
Sure. Excellent. Thank you, Meena. Point well noted. And I think we'll all have to work together on these important points. Thanks so much, Meena. And your emphasis on the vulnerable section is extremely important. That we are private sector. There has to be, of course, bottom line and focus on that. But we cannot forget that healthcare is a sector where I think it's the only sector where the word care is there in the sector's name. So thank you very much, Meena. Ashutosh, your 2 bits of wisdom, please.
I think the points Rohit made were very important, both of them. And I think Meena also said the same thing. So digital definitely is one of the ways.
Sure.
I think this makes things very, very efficient. The second point I want to make is that investment in public healthcare from the government is very much needed in India, and in a big way. And that means not only to build new hospitals, but also to make sure that the human resources part is handled properly.
Sure.
Because at least 60-70% of our population will not be able to access private healthcare, whatever we do. However efficient the private healthcare delivery becomes, people are not going to go to an economic level to be able to afford it. So I think that is very important thing which needs.
Absolutely. So more investment, perhaps in terms of percentage of GDP. Government has announced some increase. Possibly more has to be done. Thank you so much for your input. And lastly, something more, Ashutosh? Any other point?
I think 10 times of what they currently invest.
10 times, yes. We take that. I think that could be a slogan in the headline for the health news tomorrow. We need 10 times. I couldn't agree with you more. Let me go to my elder brother, I would say, Dr. Arvind Lal. Arvind, please give us your 2 bits of wisdom as we move on from this beautiful discussion.
So the first thing is exactly what Ashutosh just said, that the government has to increase, and I actually named this figure, that even 0.5% of our current GDP tantamounts to 1,20,000 crore rupees.
Sure.
Now, we don't see this kind of money. In fact, they talk about a few thousand here and there, and every year it is, it not spent and it's gone back. So This is a question of management. You must be able to manage your finances and spend the money where it is due. If you don't spend money on healthcare, you won't get anything back. And you keep on, getting after the private sector, much like the 3% of people in India who pay income tax. Well, they are the easiest targets. Second thing which I would like to emphasize is that we must make use of this time in becoming self-sufficient, at least in healthcare. There are 3 things which I think where you have to be self-sufficient. One is food productivity. You don't produce food, but nobody's going to give you from outside. I have lived in an area where PL 480 we used to be importing, food from outside. Second thing is defense. If you can't protect yourself, nobody's going to come and help you. And the third is healthcare. In whatever your act is, whether it is pathology or radiology, Philips, etc., ventilators, please get it together. And you're already known as a country which innovates as far as vaccines are concerned, some generic drugs are concerned, etc. So right now is the time to claim your position in history and start making those APIs which were not being made, and everything was coming from China. I keep saying China because I don't like that country. But anyway, that's a So, but that's what I want to say. Self-sufficiency should be the watchword.
Excellent. And it ties up with perhaps the point of technologically make in India as much as possible. Thank you very much, Arvind. Every good thing has to come to an end. Earlier this week, our Honorable Prime Minister in the 150th annual meeting of CII mentioned that we will get our growth back. That was the slogan. We will get our growth back. He mentioned 5 things necessary for taking India on a higher growth trajectory. And coincidentally, unfortunately, the same morning, earlier in the morning, Moody's had downgraded India to a rating which is just about investment grade. So Prime Minister gave the 5 I's to corporate India: intent, inclusion, investment, infrastructure, innovation. Intent, inclusion, investment, infrastructure, innovation. I see a lot of PPP already happening. I think in this discussion for the last 1 hour, many of you, all of you have mentioned things in line with this. So possibly a last bit of effort has to be there to have private sector and government come together, and leaders like you, like Dr. Lal, who have untiringly worked for that, I'm sure will make this happen. So we will all hope that healthcare gets its due attention through these 5 I's and through these turbulent times. Thank you very, very much, dear eminent panelists, for sharing your valuable thoughts in these uniquely challenging times.